Minister for Health Honorable Kwabena Mintah-Kando, speaking at this year's World Health Expo in Accra, emphasized the role of strengthening surveillance and early warning systems and emergency preparedness and investing in Africa's health workforce. He says is the backbone of the continent's health system. The Minister of Health reiterated that the critical pillar of this transformation is the ability to produce the essential tools of healthcare and said no continent can be sovereign while importing most of its medicines and nearly all its vaccines. Hence, to lead in 2050, Africa must invest in regional manufacturing hubs, strengthen pharmaceutical and medical device production, harmonize regulatory system, and build strong public-private partnerships that accelerate technology transfer. He further stated that Ghana's growing vaccine manufacturing capabilities and regulatory reforms reflect the readiness of Africa to drive this continental agenda.
Ladies and gentlemen, a critical pillar of this transformation is our ability to produce the essential tools of healthcare. No continent can be sovereign whilst importing most of its medicines and nearly all its vaccines. To lead in 2050, Africa must invest in regional manufacturing hubs, strengthen pharmaceutical and medical device production, harmonize regulatory systems, and build strong public-private partnerships that accelerate technology transfer. Ghana's growing vaccine manufacturing capacities and regulatory reforms reflect our readiness to drive this continental agenda. Yet, even the strongest national vision cannot succeed without partnerships. Health sovereignty is not about working alone. It's about leading a collective effort. It requires development partners to align with Africa's priorities, not to create parallel systems. It requires regional integration, shared procurement, coordinated surveillance, pooled supply chains, and harmonized regulation. It requires partners who are willing to move beyond traditional assistance towards long-term, mutually reinforcing collaboration. When partnerships are aligned with African vision, they amplify our strength. When they are not, they dilute it. Your Excellency, at the foundation of our national transformation is primary health care. Ghana's free primary health care program, distinct from the Ghana Medical Trust Fund, removes financial barriers at the point of care and strengthens community-level delivery.
Minister for Trade, Agribusiness and Industry, Elizabeth Ofosu-Adjare, also spoke at the World Health Expo.
For too long, our continent has relied on distant shores for medicines and vaccines and medical technologies. Global crises have exposed vulnerabilities, inequities in access, and economic drain of dependency. The time has come for a health revolution rooted in local manufacturing, powered by our ingenuity and fortified by unity. Distinguished ladies and gentlemen, let me highlight 6 areas that I believe are afraid. First, coherent, transparent policy and regulatory framework, modern infrastructure and capacity building, long-term competitive financing and smart partnership, enhancing regional integration and market access, stimulating innovation and technology transfer, and finally, ensuring sustainability and resilience. In Ghana, I am very proud that under the transformational leadership of His Excellency, the President of the Republic of Ghana, John Dramani Mahama, we are leading this transformation. We have